Once you learn about, the prevalence rates and the impact and the symptoms that we see and the challenges that individuals experience, you can't unlearn that. I often say we sometimes we create and we
Yeah.
certainly perpetuate trauma
Yeah.
within our
Yeah.
system. When we assume that these are character flaws, when we assume that these are poor parenting,
Yeah.
this is a result of poor parenting, pardon me, that
Yeah.
kind of stuff.
Yeah.
When we see that constantly, then that does mean that we're
Yeah.
intervening incorrectly.
Welcome back to another episode of Living with FASD. I am so excited to bring you today's candid conversation with Angela Geddes, a fellow social worker from Ontario, who I first met at a CanFast conference that I was attending virtually. And I've just kind of struck up with a friendship with Angie over the year. She and I are both authors in the FASD space. So there's a lot we'll be talking about in that. She's just has a new release. So we're going to get into all of that very shortly. Angie, I'm so glad that you could come and join me today for this candid conversation. How are you doing today? And please tell my audience, all about you, who you are.
Well, it's so nice to be here. Thanks so much for having me. Yeah, I am, as you mentioned, I'm a social worker. I guess it's important to acknowledge that I'm a child and youth worker first. That's what I went to school with, for many years ago, which is why now I'm
Yeah.
teetering on just over 30 years of direct service and experience working with individuals across the lifespan who
Hmm.
have a number of different issues that they want to
Yeah.
address. I started out very early on working in schools and supporting kids who had challenges with the academic environment and the
Yeah.
process. But interestingly enough, my very first encounter, my very first professional experience was supporting a young person with fetal alcohol syndrome. So in Canada, that's not a term that we use often anymore in terms of diagnosis because we've learned so much around,
Yeah.
how people interpreted those diagnoses. So
Yeah.
for example, it used to be fetal alcohol syndrome and then partial fetal alcohol syndrome.
Yeah.
And that kind of implies that it's less than or not as significant.
Right. That drives me crazy that it's the worst, the worst of the worst. It's the most damage. And I'm like, no, it just means there's facial features.
Right.
You
Yeah.
know,
Yeah.
that's
So,
all
I mean,
it means.
yeah, I think that, I think biologically, when there's a significant amount of alcohol in those early months, then, or early weeks, the nervous system gets impacted in ways that, is beyond my pay scale as well.
Right.
But we do know that the prognosis is often better for people who do have those facial features, who do look a little bit different, because
Right.
we innately recognize that and are more willing to
Give them
offer that kind of
services.
compassionate and support. So when people look like you and I, uh, and who may be struggling with some of these challenges or symptoms, that are related to a brain-based condition, then they're not often getting the kind of support that they
Right.
need. So this little fella, did have fetal alcohol syndrome, which, like I said, he was notable, right? So I often say when I'm doing my training, like, the bad news was he was exposed to a significant amount of alcohol.
Yeah.
And so he was medically frail. He had a
Hmm.
number of different conditions that were
Yeah.
obvious, and he was really quite challenged socially, emotionally,
Yeah.
and cognitively, quite
Yeah.
frankly.
Yeah.
So that was the bad news. And then I say the good news was he was exposed to enough interference that made it very obvious. So we
Yeah.
all were able to wrap around him and offer him the kind of love and support that he needed
Yeah.
in his circle. So there was never a question, does he do
Right.
this on purpose?
Right.
Is he lazy? Is he not
Yeah.
following through, or is this a character flaw? There was never a
Yeah.
question.
Is he defiant?
Right, right. So that
Yeah.
again, I like to say that's the
Yeah.
good news, but at the same time he really struggled.
Oh,
And
yeah.
then I was imprinted again as a child and youth worker. I was imprinted in a way that I'll never forget, but also a slightly misinformed, because I kind of believed that people who had fetal alcohol spectrum disorder or who were impacted by alcohol, it came from a lot of consumption. And in this
Right.
particular case, it was quite tragic because there was a history of mental health and addictions, right? So
Mhm.
again, people
Yeah.
consume alcohol for a variety of different reasons, none of which is to intentionally harm
Right.
another.
Right.
And in this case, again, it was this intergenerational and historical
Yeah.
mental health. So
Yeah.
that's where I kind of got started. So that was good. But then when you fast forward my career, where I worked again in academics, I worked in justice, I worked in children's mental health. Now that I know more about fetal alcohol and the spectrum of disorders or disorder, I look back and I think, oh, there were quite a few
Yeah.
that I supported, particularly in justice, that because I can remember saying way back then, it's not a lack of love. It's not environmental, whereas when I was a child and
Yeah.
youth worker, that's where our focus was, right? Like it was
Right.
on family disruption and dysfunction and how do we
Right.
mend that trauma and how do we address that? Whereas when I was in justice, I'm like, these parents are just like my parents. These parents
Yeah.
are doing the best they can. These
Doing
kids are not
everything they
responding
can. Mhm.
and they're not learning.
Yeah.
And the cost benefit analysis just didn't match up
Yeah.
to the criminal
Yeah.
behavior and the little bit of
Yeah.
a reward or the dopamine hit, but then this terrible consequence that resulted, like it just didn't match, right? It's not like
Right.
these guys were breaking banks or anything, it was just
Right.
petty little things and most
Yeah.
of the time missed probation appointments and stuff
Yeah.
like that, right? Due to
Yeah.
memory.
It's not like they could say, look at what they had done and say, "Whoa, that was bad,
Mhm.
but you know what? It was worth it."
Mhm.
Right? There's none of that going on.
No. No,
None
that's
of
right.
that.
Yeah, so then I went back to school because I worked in community health at a community health center, and I very quickly realized too that it's a family system. It's a
Yeah.
community school family where so
Yeah.
I went back to do my undergrad in psychology and community and school focus. So to see
Mhm.
how we can blend that and all work
Yeah.
collaboratively, which
Yeah.
as well as I know that's imperative, right?
Yeah.
So then I started working with Tracy Grant, and there was a community in our area that was dealing with the effects of drug and alcohol. So broadly, everything from
Yeah.
drinking and driving to
Right.
drinking and consuming alcohol too early and risky behaviors and that kind of thing.
Right.
And then there was,
That's what I started my career in.
yeah,
Yeah. Yeah.
yeah,
Postmasters was
right,
addictions. Yep.
yeah. And then there was an advocacy group that's called FASD. It's actually the acronym is ELMO, which is kind of funny, but here it's Elgin, London, Middlesex, and Oxford counties. So
Okay.
it's a group of us that all met. And then, once you learn about, the prevalence rates and the impact and the symptoms that we see and the challenges that individuals experience, you can't unlearn that.
No. No,
And
you're
once you
forever
see it in
changed.
your practice and then you
Yeah.
start to screen and assess in a different way, you start to
Yeah.
realize how the system is often I often say we sometimes we create and we
Yeah.
certainly perpetuate trauma
Yeah.
within our
Yeah.
system.
Yeah.
When we assume that these are character flaws, when we assume that these are poor parenting,
Yeah.
this is a result of poor parenting, pardon me, that
Yeah.
kind of stuff.
Yeah.
When we see that constantly, then that does mean that we're
Yeah.
intervening incorrectly.
Yeah. And
Families,
it's
yeah.
perpetuated too when we place children in foster homes that are not trained appropriately.
Well, absolutely. And I would argue
You
that
know.
in many cases, if we kept the kids at home
Mhm.
and supported the kids in a way that made more sense,
Yeah.
like, I've got countless examples of I used to coordinate. So after I went to school to get my BA, I kept working in community health. And then I decided that I wanted to get my master's because I
Yeah.
really was intrigued with learning more about fetal alcohol spectrum disorder and how we could build and sustain
Yeah.
assessment and support services in Ontario. So that was
Yeah.
my focus. Yeah, it's just incredible how often you see it, how often you see families misunderstood and how you
Yeah.
see parents just like, really
Yeah.
feeling like they're the wrong parent for the child, whether it's
Yeah.
biological or not. And they
Yeah.
just like,
Yeah.
What am I doing wrong? Why is everybody
Yeah.
upset with me?
Yeah.
And
And the other thing that would drive me crazy, I worked for smaller foster family agencies that
Mhm,
contracted services to the county. It would drive me crazy listening to county social workers, bless their hearts, completely overworked,
mhm,
caseloads ridiculously high. There's no way you can provide quality services to that many kids and families and expect the ideal outcomes that we all hope for because of that pressure working in child welfare system. It's a pressure cooker.
mhm.
And my heart goes out to them, but it would drive me crazy to overhear them say, why aren't these parents getting it together? It's not like we're asking them something hard.
Mhm.
Where's their motivation? What's their problem? Never putting two and two together. If
Right.
kids have been impacted by alcohol and other drugs, then chances are the parents have too. So
Mhm.
maybe the parents have fetal alcohol spectrum disorder or something equivalent where there are neurological reasons that make it challenging to do the things that the outside world expects of them.
Well, I think that's definitely part of the equation in
Yeah.
many instances, intergenerational trauma,
Yeah.
intergenerational mental health, intergenerational alcohol exposure. I mean, it
Hmm.
happens and I see it and it's indiscriminate. And
Yeah.
that's been my argument all along. And, and it's done the stigmatizing language, the stigmatizing, the biases and the misunderstandings are rampant.
Hmm.
And it's done sometimes innocently. Like for example, there's an article in the London Free Press. There's some activity going on. There's some puppeteering going on, and I don't know the details, but I know that there's some pretty famous puppeteers that are taking this on, and they're going to bring attention and make increase awareness around fetal alcohol spectrum disorder. But in the title in the London Free Press, they use the term fetal alcohol syndrome for one thing, which again is not a diagnostic term that we commonly use.
Yeah.
And then within it, they were interviewing one of the puppeteers who happens to be First Nations. And he said, again, innocently, he said, this one really rings home to me. I'm very passionate about this because FASD is very common in our communities. And I think fair, I hear what you're saying, but again, FASD is not an Indigenous only problem. In fact, Indigenous folks are less likely to consume alcohol during pregnancy than Caucasian, well educated
Yeah.
women between ages 25 and
Yeah.
35. However, we can't neglect or not talk about the problem of intergenerational trauma and the link sometimes that there can be with alcohol consumption as medicine
Hmm.
or as a problem, right?
Yeah.
So when we drink to medicate, so to speak, then there's a higher risk, right? And then to me, this is what I often say too, like trauma, people can overcome trauma. But when you have trauma that's coupled with developmental trauma or an
Yeah.
existing interference, the
Yeah.
way you process that trauma is very different. The way you reconcile
Yeah.
that trauma is very
Yeah.
different, right? And
Right.
so we can't just blame all of the problems that society's having on trauma alone because that's not the whole
Right.
picture.
Right.
Hmm.
I kind of discovered that in my own journey within the agency I was working for.
Sure.
So, Angela, when did you start writing?
Well, that's a funny story actually, because masters of social work is when I mean, I guess I've written when I did my master's. I initially tried to avoid the thesis part of it like the plague. I really wanted to do, I really wanted to do a practicum, and what I wanted to do was to develop curriculum for community colleges. That's what I was
Hmm.
hoping to do. And I was on that track, but then my professors told me that I had, because I'd already been a professor, that they didn't feel like that would be enough of a learning curve for me, that I would be a little too, anyways, they thought that it would be
It
better.
wouldn't stretch you enough.
And that's right. So in
Yeah.
fairness, I'm like, okay, I guess maybe, but but this is important, right? Like FASD is not in most post-secondary
Right.
education facilities, so or
And
agencies,
it needs to be.
institutions. Exactly. And so, but then they were really guiding me towards writing this thesis, and I was like, oh gosh. So, anyways, so I ended up doing it. It was, and I'm really glad that I did, because what I did was I took our five main ministries that deal with, children, youth, families, and FASD.
Mm.
And I call them their bread books, the ministry bread books, what they say they do. And I found
Yeah.
intersections or commonalities and opportunities for us to work together, each of the agents or each of the ministries to work together, and
Mhm.
then sort of developed a bit of a plan. So if people would just listen to me, I've got some really good ideas, but so far I'm not in politics yet. So when I finished writing that, which was quite a journey, my professor said to me, I look forward to reading your first book. I just know that you've got it. This is such a, it's such
Mhm.
important information. I can see your passion. And she just went on. And honestly, I nearly laughed, because if you know how many tears, were cried during that thesis writing process, I said,
Mhm.
like, I just didn't think it was going to happen. But then
But
I
she
realized,
planted a seed, didn't she?
well, and it was really funny, because it wasn't until like a couple years later that I started writing this. And then when I was doing my credits, I went, she did plant a seed. Like, she really
Mhm.
did. She fundamentally gave me the idea that this was possible. So anyway, so that's kind of where it started.
Did you put her in your acknowledgments in any of your
Absolutely, I
books?
did. Absolutely, I did.
That's
Yeah,
awesome.
unfortunately, her name is Karen Macaulay, and unfortunately, she passed away suddenly. So she
Oh.
never did see it. But I think that she was definitely cheering me on for a while. But, the bottom line is, the more you work in this field, the more you realize that people just, there's so many overlapping characteristics, Patty,
Yeah.
like, that, right? So most of the people that I see are misdiagnosed, or, well, there's concurrent disorders that obviously work,
Right.
that are diagnosable, but the clear picture is not seen with,
Yeah.
and we've talked about this before too, and Dr. Lana Popova's research indicates
Mhm.
clearly that 2% of the population globally, 2% of those who should have a diagnosis, do not have access to an assessment. In Ontario,
Mhm.
we know that it's 0.5%.
Mhm.
So that's less than 1%. And when to use the analogy, when you say alcohol-free beverages, for example, they're
Yeah.
usually at 0.5%. So
Yeah.
basically nobody in Ontario who should have a diagnosis really does.
Yeah.
And the people who do have a diagnosis are the ones that are really struggling,
Yeah.
or have parents or part of the system that they're astute enough to say,
Mhm.
okay, we need to dig a little deeper. But most people are not looking for an
Yeah.
FASD diagnosis, right?
Right.
So,
And it's that general lack of awareness and lack of being talked about in graduate programs, whether it's medicine, psychology, social work,
yeah.
counseling. You can look at seminaries. Every field that works with people should know and should have an up-to-date education.
Well, it's really interesting that you say that, because once I finished my thesis, I was working as the assessment coordinator at a pilot diagnostic clinic in London,
Mhm.
Ontario. And in the spirit of capacity building, after I had done that for a while, I realized I've learned as much as I can learn. It's time for somebody else to do this and build it.
Mhm.
And then we
Mhm.
can just sort of continue to build capacity
Yeah.
by training, by offering other people the ability to screen and assess in a
Yeah.
good way, so that
Yeah.
we can put people on a path for
Mhm.
diagnostic clarity, even in light of the fact that we're probably not going to get a formal diagnosis. So I've always believed that we can do better with or
Mhm.
without a diagnosis. It's not imperative, which is, I'm proud to say that we're going
Yeah.
to Seattle to present on that,
Oh,
right? And the role of
good.
social workers and how we can do a different, do things differently.
Yeah. Yeah.
And so then following my thesis and my, that the graduation from the MSW program, I decided that I would take some contract positions. So I'd never worked in a
Mhm.
hospital, for example, and I never worked in really acute and chronic mental health and substantial mental health, adult mental health services. So I took a
Yeah.
couple of contract positions there, and I saw firsthand how
Yeah.
the hospital system doesn't have any idea,
Right.
of how to do little things like dim the lights, lower the
Yeah.
bells and whistles, change
Yeah.
your medication schedule, knock on the door and make sure that you tell
Yeah.
this person that you're coming at a certain time.
Right. Right.
Be cautious around certain things. And it just wasn't happening. And then of
Right.
course, being a social worker on the floor, they would call me, and I can remember meeting this one gentleman, and he was so ill due to intravenous drug use and this kind
Mm.
of stuff. He was so ill.
Mhm.
And I called his mom with his permission. And within 5 minutes, I learned that this was an unplanned pregnancy. His symptoms were diagnosed as schizophrenia because the father was a little bit older. So they put that connection together. Meanwhile, she was able to say there was alcohol consumed during the pregnancy
Mhm.
before I was aware. And just doing a quick little developmental history, I'm going, oh my goodness, like all of these boxes are being checked, right?
Yeah.
So
Yeah.
then I had to go to ethics in the hospital to try to get him the kinds of services that he needed, and it was just met with a lot of resistance. Like it's
Mhm.
just such a challenging thing. So and then
It
I took other contracts as well to
yeah.
see what this looks like. And then going back to the book, I was realizing people are not understanding that this is brain
No.
based, and
Exactly.
what does this look like across the lifespan?
Yeah.
And as a social worker, so this is my first book, A Complicated and Beautiful Brain.
Mhm.
But as a social worker, I mean, even you don't know how to label it sometimes because it's not fetal alcohol spectrum disorder, but in my mind, I think it probably is, right?
Mhm.
But I can't diagnose within my scope of practice, and nor would I ever assume anything like that, because parents are not going to be very happy if I give
Yeah.
resources for fetal alcohol spectrum disorder, even if they will work, if that's not the diagnosis they have. You can
Right.
see, it's like giving resources for diabetes, but there's no diabetes,
Yeah.
right? We
Yeah.
just think it's diabetes, right?
Yeah.
So and so I couldn't do that. So then I thought, well, I think more people need to know what FASD or what the effects of prenatal alcohol
Mhm.
exposure looks like across the lifespan. So that was the purpose of that. And a lot of that was done with my thesis and my research
Mm.
and, the
Mhm.
gazillion journal articles that I've written. And then in my
Yeah.
private practice, what do I see every day?
Yeah. Yeah. It seems to me that in many systems, there's an acknowledgement that FASD exists, but the hesitation is at being open to learning just how varied the expression of it is
Hmm.
and how broad the impacts are, and
Right.
what does it look like, as you
Hmm.
said,
Hmm.
and just how big of a part of everyone's caseload it really is. It's
Well,
kind of overwhelming once you crack that door open to
mhm.
realize how differently things could have played out. If
Well, yeah. And
Of
I
course,
think,
hindsight's always 2020.
yeah, no, absolutely. But I also think that what gets lost too is, yes, the prevalence rates in Canada are 4%, and we know that's still low estimated. But the recent prevalence rates across North America are 8%. Well, we're not that different. 8% is still
Yeah,
low estimated, which again is very close to
yeah,
10%. I mean, that's a lot. Like,
yeah,
when I started in this field, it was 1 out of 100. Now it's 1
yeah.
out of every 25, which essentially is 1 in every classroom. Now we're
Well,
talking 1 in 12 across North America. Like that is
mhm,
pretty.
I had been looking at 7.1 as the most up to date stat I had seen. Just 1 in 14 kids have an FASD regardless of diagnostic, you know.
Right. And now where's that? In the States
So,
or?
yeah, that's the states.
Yeah. So, I mean, and I think we both know that there's certainly pockets of communities where the rates are a bit higher than that.
Oh,
But
yeah.
where the rates are definitely higher than that are in service agencies where you're
Mhm.
already going looking for
Yeah,
help. So we're not
yeah,
talking about 4% or 7% or 8% anymore. By the time
yeah.
they funnel through that door,
Mhm.
we're looking at, and Dr. Carl Bell, which I quote in this book and in my thesis and in a lot of my training. Dr. Carl Bell was from Chicago, and
Mhm.
he's since passed away, but he was a lovely man. And
Right,
I actually
right.
called him and he called me back. We spoke and had the most beautiful conversation while I was the assessment clinic and coordinator in London. But he was talking about his clinic, and it's called a hidden epidemic. If you Google it, you'll find his research. You maybe already have, but I encourage the reader to have or the listener to have a listen or have a read. because he found that, around 50% of the people coming to his mental health clinic were actually diagnosable.
Yeah. Yeah.
So that's huge. And I mean, I don't have
Yeah.
statistics in Ontario for mental health services. I just know from my practice
Yeah.
that we're not talking about 4% of the people that come through my
No.
door in particular,
Yeah.
and in children's mental health too, and who are looking for a school social work or a school psychological evaluation. Like by the time you get to so limited opportunities
Yeah.
for a psychoed report,
Yeah.
you're talking about people who are really, really struggling with complex
Yeah.
challenges,
Yeah.
not just people who have depression or anxiety or a
Right.
little ADHD.
Right. Right. Yeah.
And I don't mean to minimize the significance of depression, anxiety, and ADHD. That's not what I'm doing,
Right. Right.
but it's more complex than that. So, and then again, once I got finished, I coordinated a couple of projects when the Ontario government invested into some strategies that were FASD specific. I was honored to be a lead in that process. So
Hmm.
I was coordinating the support group project and the
Yeah.
website, that kind of thing. And then after that, I just decided that I wanted to go into my own practice, because when you're in your own practice, you get to be a little bit more flexible. You
Yeah.
get to,
Yeah.
um, yeah, you just get to do things the way sometimes they need to be done.
Yes.
And I don't fire patients who don't show up. I don't
Yeah.
charge them if they don't show up.
Yeah.
Don't tell anybody that, but
Do I need to delete that from?
yeah, no. But it's those are the kinds of things, and you have to do a little bit extra. So, and a lot of the work that I do, I mean, I've always been a big family, like my practice is very family oriented, right? So
Hmm.
I create safe spaces for everybody that comes in, and I
Yeah.
ensure confidentiality, but I also make it very clear to my people that it doesn't matter if you're 14 or 44 or 74. We kind of have to work with this collaboratively. And we have a team approach, and nobody knows you or loves you more than your parents and your family members. So we
Yeah.
kind of have to pull them in on occasion. And that's sort of said from the outset.
Yeah.
And of course, I would not share anything. Parents call me and say, this happened this week, be careful around it. But, can you kind of dig around that a little bit?
Yeah. Yeah.
I think that's imperative, because lots of times by the time individuals come to session, they kind of forget what happened 3 or 4 days ago, and they're just here and they're not really sure what to address.
Yeah.
Right. So,
Yeah.
which is why sometimes people don't offer therapy services to people with FASD, but I think
Yeah.
that a therapeutic alliance is critical and can be very, very helpful.
Yeah.
So
Yeah.
so that's why I wrote the second book, is not your tip um my second book is called Not Your Typical Parenting Guide,
Yeah.
because I have very similar conversations, with a lot
Hmm.
of different parents. And one of the things that's difficult for me is, it's my sessions are an hour long, 50 minutes long or whatever. And one parenting session every 1 week or 2 weeks is not quite enough, to
Yeah.
get
Yeah.
everything you kind of need foundationally. So
Right.
I'm kind of rethinking some of this too. You're always evolving, but that parenting group or parenting book is more like, okay, what are some of the areas? What are the symptoms? What do we assess for?
Yeah.
We assess for sensory processing. We assess for executive functioning. We assess
Yeah.
for adaptive behavior. What does that look like in your home?
Yeah.
And how can you support that in a way that
Yeah.
results in maybe less conflict, maybe a little more harmony, maybe a little more,
Yeah.
kind of a collaborative approach and a different way to
Yeah.
get to the same place.
Yeah.
So
Yeah.
that's what that book is about. And, I work with a lot of families who feel legitimately that their school system is not prepared, not clear on what the
Yeah.
complexities kind of look like and what that means.
Yeah.
Everybody tends to see it as a behavioral issue. It's even labeled that in our IEPs because there's not a
Yeah.
specific developmental criteria, that they
Yeah.
fit under. But behavior implies that we can modify it and we can
Yeah.
fix it. And
We can motivate it away,
right, yes.
right?
And we
Through
can,
either rewards or negative consequences. If
yeah,
we find that magic, carrot or stick,
yeah. Yeah.
then eventually they'll make the choices we want them to make.
Right, and we know that that doesn't work
No,
that way. So
nope,
that's
not
why
at
I
all.
wrote the 3rd book, which is not your typical teaching guide. So I do
Okay.
offer some training to schools, and I think it's kind of important to note too that a couple of the child and youth worker programs have taken on the parenting guide and this complicated and beautiful as required reading.
That's awesome.
The feedback is phenomenal, Patricia. Like it's just, I least 3 at least 3 people at the end of
Yeah,
class come to me saying that they think that they've been impacted or
yeah,
somebody very close to
yeah,
them, or this explains with for their own child,
yeah.
So, and I just create, and it's important to note too that everything that I write and everything that I say and everything that I do in terms of training, I know that there's somebody in the audience who
Mhm.
has FASD.
Yeah,
And so,
yeah,
these books are not simple, but they're written for everyone,
yeah,
right?
yeah.
And the greatest compliment I ever got for this one was a young person who was reading it, not yet diagnosed, but she said, I just felt, I read myself in the pages. She said, I
Mhm.
just wept.
Yeah.
And then she later said, I can't remember everything that it said, but I remember how it made me feel. And for the first time in her life, she didn't blame herself and she could make sense of what she was experiencing.
She felt validated.
Yeah. Yeah. So
Yeah,
that to me was so,
yeah,
so important.
yeah,
And
yeah,
then again, the parenting guide is the same thing. It's like any parent with FASD can read it, a youth can read it.
yeah.
I had a request from a young woman with FASD who said, "Could you write one for relationships?" So that's my next one. But she gave this to her partner, her fiance, and her fiance came into my office. He said, "I just can't get over how helpful it was. It made so much sense."
Yeah,
But she didn't
yeah.
like that it said parenting because obviously
Yeah,
that's my
yeah,
partner, not my
yeah.
parent, right?
Well, as we age, our challenges can, some of them we get those workarounds that become habitualized and we can move on from that one.
Right.
But life brings us other environments, other
Yeah.
situations, other demands, and we discover new challenges in that.
Yeah.
In those new capacities, those new roles. And spouses, it's not that different than the parenting, not that they have a parenting role with us,
No.
but in terms of how do we support, how do we question everything that we thought we knew
Absolutely.
about how people think, how, why they do the things that they do.
Yeah.
One of the problems that I think is foundational is the nearly universal paradigm that all behavior is chosen. It's
Right.
intentional. It's to meet a need. And if we can't think of the motivation off the top, if it's not obvious, then it's secondary gain,
Yeah.
right? It's for attention or it's to get back at somebody. Like, people are automatically passive aggressive. Yeah, no.
Mhm.
But,
Right.
going back to that diagnostic, the number of people who actually have the diagnosis, you had said 2% get the assessment, but only 0.01% get the correct diagnosis. There's a
Yeah.
lot of people that end up with a partial diagnosis if they have a comorbid condition like ADHD or autism
Mhm.
or some other thing or some other mental health
Yeah.
condition, or they're just misdiagnosed entirely, or because of the psychological cognitive testing that's done, there's scattered findings. So the assessors don't know what to do with it. So they just send you out the door. Well, yeah, something's going on, but I don't know what it is. And it's not alcohol related because there's no pattern. Well, there is no pattern for FASD. The scattered findings are the pattern
Right.
for
Yeah.
FASD.
Yep.
Yeah.
Yeah, for sure.
And
And that's
that,
why, I've been very passionately involved in creating, more training for diagnostic clinicians and teams. Like,
yes.
how do we operationalize the guidelines? How do
Yeah.
we rely on clinical judgment? How do we
Yeah.
rely on putting this in and of itself might not be that significant, but this plus this plus this plus this is very significant. And how
Yes.
does this look in the real world, right?
Yeah.
So
Yeah.
my work is grounded in research for sure.
Mhm.
And
Mhm.
also I'm quite honored to say that I continue to learn every day by the
Yeah.
people who walk into my office, right?
Yes.
And so the other thing that I feel, and I think, the research says that the prognosis for individuals is better the earlier we get diagnostic clarity. That makes sense, right? If you know you have diabetes, you can make that adjustment. If you know that you have depression, you can, go about with best practices and get the kind of treatment that you need to improve your outcome.
Yep.
If you don't know, then it's harder.
Yeah.
And so given that so few, have that access, I mean, we need to figure out, how we
Yeah.
can be helpful. So
Yeah.
I continue to see people in my office who struggle with A, not knowing what it is, and B, sometimes the insight's not there, right?
Mhm.
Sometimes
Yeah.
there's not entirely clear on what this actually means. But then I feel too like we all sort of judge ourselves by our
Mhm.
behavior now, right? So if I steal something from you, I think I'm obviously that's a character flaw. Like I'm capable of theft. If I don't tell the truth 100% of the time, then I'm capable of being dishonest. I may not like that about myself. And so then if I believe that I do it, it becomes a part of who I am, then I live in shame, or I
Yeah.
live in not aligned with
Yeah.
who I think I want to be or
Right.
who I think I
Right.
am. And that's why a lot of the work that I do circles around acceptance commitment therapy or acceptance commitment training as well, which I think works so nicely with people who have FASD or a
Mhm.
complex neurodevelopmental condition, because I love ACT because it's universal and distress is universal. Right. So
Mhm.
it doesn't really matter what your background is necessarily. Obviously, we have to be informed. We have to be
Yeah.
trauma informed, and FASD informed. But, the bottom line is Houston, we have a problem.
Yeah.
Right.
Yeah.
So we
Yeah.
can either make this problem bigger or we can make this problem smaller.
Yeah.
But the problem is not something like if it were, I hear people say it, well, I'm just lazy. Like I can clean my room. I just don't. Well, yeah, I know you can pick up a shirt off the floor, but doing it all together,
Yeah.
and getting it all done in a timely fashion that makes
Yeah.
sense is overwhelming, and that's
Yeah.
not your fault. So if you need a helper, we need to embrace that. We all need helpers. So this book is written for people with FASD. So I'd be really gracious to hear what you have to think about it. It talks about acceptance. It talks a little bit about surrendering too. Like, because I just feel like when people do get the diagnosis, you can see their shoulders see like, okay.
Oh yeah.
And so,
I remember in my case, Ange, I came to self-awareness of having most likely being on the spectrum when I was studying under facets so that I could better support the kids and families on my caseload as
right.
a post-adoption social worker, foster care worker. And, the more I'm learning about the primary characteristics or those challenges that we have
Mhm,
that are a direct reflection of the neurological rewiring, right? Of
mhm,
having a complicated and beautiful brain.
mhm,
And then also some of the secondary symptoms, which are those behaviors that reflect the mismatch between the way we work and the things the environment expects of us.
right.
And the more I'm recognizing, oh, I do that, I do that, I do that. Oh, crap, I've done that too. You know,
Mhm,
it's like, wow.
mhm,
And then we had this exercise that we did in the classroom setting of imagining what our brains look like when they are working, right? And then everybody's concept is different,
yeah.
but that's because everyone's brain is different.
Mhm,
And then the homework was to go do that exercise with family members
mhm,
to get accustomed to having these somewhat challenging conversations
mhm,
and to normalize the diversity in the way that we work. And so I was doing it with my mom and I was talking with her, which is kind of silly since she has dementia. It's like,
mhm,
how well could she participate in the conversation? But it was practice, right?
yeah.
And my husband walks through the room and he's like, So that's what's wrong with you, right? Just being totally sarcastic, off the cuff, not even realizing how vitally important that statement was, right? So I'm like, I don't know, Mom,
Yeah.
did you drink while you carried me? She's like, oh yeah, every day. With such surprise, like who doesn't?
Right.
But it was in the early 60s. Nobody knew any, it was 10 years before Kenneth Jones and
Yeah.
his group of researchers kind of figured out, hey, there's a pattern here.
Yes.
And so nobody knew. All of a sudden, things started falling into place for me.
Hmm.
All of us, when we have struggles and challenges, when painful things happen in our lives because the way we work versus the environment that we are in,
Right.
we all experience pain and rejection and difficult moments.
Hmm.
And it's human nature to try and figure out the why, right? What explains this? And all I had to point to in my childhood was being diabetic. I was the only one in my community. It was very rare back then.
Hmm.
And having a divorced family,
Hmm.
divorced parents, because that was not common yet. And those are the only things that I could point to, but they didn't really do a good job of
No.
explaining my foibles, you know,
Right. Yeah.
my quirks.
Well,
you know, so learning about FASD, it's not just as we were saying earlier, once you learn this stuff, you can't unlearn it.
right.
There's no unringing the bell,
No.
but it really explained me in a way that made sense. So coupling that with the statistics, how few of us ever find out, oh, this is what it is. This is the answer. That totally changed my world. It got me out of kids and families into being a mirror for adults
Right.
who have struggled and
Well, and
grown
that's
up.
interesting because I mean, our services are dismal for
Yeah.
everyone, but especially for adults,
Yeah.
right? Like
Yeah.
and I've always said, like, there's way more adults with FASD than kids, given the prevalence rates. I mean, all you have
Yeah.
to do is the math, right?
Well, it's 7.1% here in the States. That's almost 25 million adults who don't understand that their foibles, their struggles, their challenges, their inability to finally learn something, right? Or to stop finally making the same mistakes over and over and over again, have
Right.
a biological basis.
Yeah. Well, and
You
that's
know?
the thing too. I mean, I don't really get it why politically we're not, doing more. It makes no sense to me. And when we have some politicians imply once again that autism is, we're seeing such higher rates of autism and the only thing that we can account for is, vaccinations and that kind of thing and what we're eating and I think, well, are all the cases we're seeing that we think are autism, are they all autism or are they
Bingo!
right?
Are they FASD?
Yeah. And I think like what blows my mind is that we've already debunked the idea that vaccines are linked to autism. Like
Yeah.
scientifically, that's been proven not to be the case.
Yeah.
I'm not here to say that some people don't have a legitimate concern with some vaccinations. Fine. I don't care. I'm not here to
Yeah.
tell you what to think. But we absolutely know that
Yeah.
alcohol and other various substances matter. Why are we not
Yeah.
posting that?
Well, one of my guests, Dr. Susan Rich, I don't know if you've heard any of the episodes she was on. She's also very passionate about this very thing.
Hmm.
And she pointed out in one of our conversations that alcohol as a neurotoxin, it is managed by a different agency than any of the others. And I don't know what the system is up in Canada where you are,
Hmm.
but here over all drugs and over food and things like that, it's the FDA, Food and Drug Administration,
Hmm.
except alcohol. Alcohol should be there, but alcohol is over with the ATF, alcohol, tobacco, and firearms. And all the ATF worries about is permits and collecting the fees.
Hmm.
They could give a crap about what tobacco does to people. That
Hmm.
Dr. Ira Chasnov says that maternal smoking is the number one cause of ADHD. Does the ATF care about that? No. And do they care what alcohol does to the quality of people's lives? Probably not. Do
Right.
they care about FASD? What's that?
Mhm. Mhm.
Right?
Yeah.
She went to University of North Carolina, had alcohol, had to go through all the rigors that the FDA puts various drugs through.
Mhm.
Alcohol never would have been approved
Right.
for consumption
Yeah.
ever. And so it enjoys, it looked at what happened to big tobacco when smoking fell out of social favor, and it learned. And so it's a very powerful industry with a lot of money in government.
Well, there is a lot of money, and it's interesting because I had a conversation with somebody not very long ago too, who happens to be indigenous, but she did struggle with alcohol use and misuse in her earlier days. And then she said, things just got so much easier for her when she didn't demonize alcohol. And I found that really powerful. And I think that
Mhm.
we know, like the research is very clear, that it's not good for us, but yet there's also a cultural connection that with alcohol that's just such a big part that we can't ostracize and shame
Yeah.
people for having
Yeah.
um a relatively, if you can use the word, healthy relationship with socially,
Yeah.
you know what I mean? Like we
Yeah.
can't we
Yeah.
can't demonize and shame people. I was at
Right.
a conference and I was talking to a woman who said, like, I never drank during any of my pregnancies. I never drank while the kids were little because I wanted to be on point and, I
Yeah.
make sure that I was there for them all the time. And now I want to have a glass of wine once in a while and I feel like I feel shame for that now, And so
Yeah.
I think that we have to be careful around that. And I think
Yeah.
we can do two things at the same time. And I really think that, I've always been saying, as long as I live, I will never stop talking about the effects
Yeah.
of prenatal alcohol exposure
Yeah.
and the effects of alcohol overall in our
Yeah.
well being.
Right.
But I also will just keep talking about, there's a big difference in my mind between choosing to run up to the store and not put my seatbelt on than not putting my child's seatbelt on. And I think that is different. And again, I'm not trying to blame or shame anyone because I do not believe people consume alcohol with the
Yeah.
intent to injure anyone or harm
Right.
anyone.
Even the self.
But when we don't
Yeah.
know,
Yeah.
what's really going on, and that's why
Yeah.
I have a podcast called Kitchen Table Conversations, because
Yes, I love it.
in my opinion, that's where we learn the
Yeah.
most important information. It's, okay, I heard about some risks around, SIDS, for example, when my kids
Yeah.
were little. And I was very aware of that. But
Yeah.
now, kids are not, there's no teddy bears in their cribs anymore. There's no bumper pads in their cribs anymore.
Yeah.
We had all of that. And all
Yeah.
of our kids survived. And, so I
Yeah.
think the pendulum's personally swung a little too far, but it's okay, right? We'll get there. Um,
Pendulums do that.
Yes, they do. And but again, it's around your kitchen
Yeah.
table that you have
Yeah.
these conversations and you learn from the
Yeah.
people that you love. And if
Yeah.
you're given the wrong information, you're going to keep
Yeah.
perpetuating that, right?
Right.
So that's the point of some of these conversations. So I'll never stop talking
Yeah.
about it, but I'm going to try very hard to continue with a harm
Yeah.
reduction and give people the information that they need in order to live
Yeah.
their best lives,
Yeah.
you know?
So where can people find kitchen table conversations?
On
I
all
know.
streaming platforms.
Okay, because I know I listen to you on Spotify.
Yeah,
Yeah.
awesome. Yeah.
Yeah. Yeah.
It's on all streaming platforms, so anywhere you get your podcasts, it'll be there. And they
And
are just, kind of short and shareables. We do some deeper dives where we have interviews around specific topic areas, but I have
mhm.
created, like, yes, I've created these books, but there's also like a ton of free resources on my website
Yeah.
as well. Like there's safety
Yeah.
plans, there's books for people who are just entering the system, recognizing that their kids have a complexity,
Mhm.
how to get
Mhm.
started and what do they need to do to stay
Yeah.
organized and take care of themselves. We have lots of information around for schools and educators
Mhm.
that's free on there, and updated information sheets, that
Yeah.
talks. Yeah,
That's
so
almost a full job in itself is keeping the resources updated.
yeah,
Things
absolutely.
change so fast.
Yeah. Yeah, no, for sure it is. And I still have a very full practice. and
Yeah.
building some
Yeah.
teams. But I also do training specifically for social workers and allied health professionals so that we
Mm-hmm.
can build capacity. We do not
Yeah.
have to be
Yeah.
experts, but we
Yeah.
have to be aware.
Well, in any one person, all we can do is throw pebbles into the pond,
Yeah,
right? To make changes. And the ripples from one pebble don't go all that far. But so the more people we can give pebbles to,
that's right.
the sooner we will get that sea change.
That's right. Yeah.
So,
Yeah, for sure. And
yeah.
yeah, we'll just keep talking and keep
Yeah.
yeah.
How often do your podcasts come out, Ange?
Usually every 2 weeks. I was doing them
Okay.
weekly, but I found it very, it is time consuming for me.
Yeah.
So,
Yeah.
and it's not my favorite
Yeah.
thing to do, but every time I think about not doing it, somebody says, "Oh, I really appreciated that last episode.
Right?
Really liked
Yeah.
it."
Yeah.
And it is important. So I will keep
Yeah.
doing it, but
Especially for us indie podcasters,
mhm.
doing most of the work, if not all of the work by ourselves.
Mhm.
It is very, very time consuming.
Yeah.
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 But
I really appreciate your time
yeah,
today.
well,
It's
thank you
such a
so much.
gift.
Thank you
And
so much for having me and, yeah, allowing me to chat about this, and I get asked to do training a lot, and I'm honored to do it, but I always ask them, like, "How much time do you have?" Because I could talk on this for a half
right?
hour
Forever.
or I could talk for a week. So let me know
Yeah.
what you want,
Yeah.
and we'll go
Whenever I go to one of my medical providers, if it's the first time seeing them, I give them a copy of my book.
from that. That's good,
Right?
yeah.
Especially because the adults are so under-recognized.
Right. Yeah,
So,
yeah.
yeah.
Well,
Yeah.
it's funny because on my website too, Patricia, I do have a customizable like screening tool that allows people and their helpers to go through it to talk about, challenges or, or symptoms. Like, what are like,
Yeah.
so sometimes, when I go to the hospital, I need to have somebody there because sometimes I don't remember. Sometimes I get a little bit anxious. Sometimes, so it's a
Yeah.
checkbox.
Yes.
And I find, like, when I go through it with people, people are really like, "Yep, that's me, that's me. Nope, that's not me." Like, they're very, very
Yes. Black
honest,
and white.
and
Yep.
again, it's very
Yeah.
much like, "This is what bothers me in the real world. This
Yeah.
is what I'm afraid of in the real world. This is how you
Yeah.
as my nurse or my doctor or my social worker can help me. How can we
Yeah.
problem solve together to reduce harm?"
Yeah. Yeah.
Yeah.
Yeah.
So
That's awesome. What a wonderful resource.
yeah, yeah,
So,
it's getting yeah, I think it's helpful, but
yeah. Well,
mm,
thank you again for
okay.
the gift of your time today. I know you're super busy,
Well, yeah.
and I
Yeah,
hope
I
you
appreciate
have
it.
I hope you have a beautiful day.
Okay, thank you. You too.
And
Thanks.
thank you again for joining me. I am so glad that you tuned in to today's candid conversation, and I hope you found it very valuable in adding to the breadth and depth of your knowledge about fetal alcohol spectrum disorders. I also hope we made you laugh along the way. I'm so honored to bring you these candid conversations week by week, and I'm so grateful that you keep coming back. You are my faithful audience, and I'm so grateful for you. Please reach out to me at livingwithfasdpodcast@gmail.com. If you have suggestions on topics you want me to cover, that you want maybe to learn more about, or guests that you think would be excellent to invite to be on the show, I'm always happy to get your suggestions. And I'm also happy to hear if any of these episodes have touched your life. Please share your story with me. You never know, I might invite you to come on the show. If you want to pick up a copy of my book, Sip by Sip, Conversations with Adults Living with FASD, you'll find the ordering links in the show notes, along with my Calendly link if you want to schedule a complimentary call to talk about any training or coaching needs that you might have that I might be able to help you with through my company, Casper's FASD Life Coaching and Training LLC. Now, if today's guest has given me contact information to share and you want to reach out to them, that information will also be in the show notes. So in the meantime, I just want to thank you again for taking time out of your busy week to watch or listen to this podcast on whatever platform you have found me on. And please, please, please subscribe, and share this podcast so that others can find it. That's how they find it, is when you share it. And the more people that find the podcast, the more people learn about FASD and the less hidden we are. So that's it for today. It's a wrap. Have a great week, everybody. And we'll see you next time on Living with FASD. Take good care.